And we'll go to that very deadly disease that has hit Guinea, killing about 78 people. Earlier reports suggested that Liberia had also contracted this. Initially, the government denied it, but we understand that indeed it is happening there. Of course, that also scares the country that we live in. And so we'll go on the phone line, speak to the Director of Surveillance, Ghana Health Service, to tell us, Dr. Bedu Sarkodie. A very good afternoon to you.
Good afternoon.
Right. Last week, we did hear of an emergency meeting to curtail this. I mean, should Ghana experience it? What happened? What has happened?
Please come again.
I'm asking what came out of the emergency meeting that you held.
Yes. The meeting that we held, indeed, yes. It was a planning meeting. It was a workshop bringing all stakeholders together, people whose activity impact positively on health, and we, from the health sector, from the disaster management, agri, veterinary, wildlife, the development partners, World Health Organization, UNICEF, and all people whose activity impact on health within the country. We came together to update our preparedness and response plan, to look at what we have regarding this alleged state of this outbreak in country, and should there be a case, what exactly do we have to do, what is required, who should do what. And so basically it was a workshop to update our preparedness and response plan, which out of that meeting we formed work groups in specific areas, in surveillance, in human population and the wildlife, and the laboratory containment, and then the case management within the hospitals, the logistics requirement and security, and then coordination, what it takes and to do what, and how much does it require, what is available, and where do we look for support if there's a need for us to go out and reach out for support.
All right. With these work groups, I mean, this is something that is happening. What are the timelines for the work groups?
We formed the groups on Friday. Tomorrow, another group, the various work group have started their working meeting again tomorrow to actually consolidate what has been put in place. And I'm sure by the end of this week, the various work groups should have finished their draft plans or updated their plans and submitted it to the central level.
All right. Even before they present their findings as a work group, are we prepared should anything of a sort, the Ebola virus, should it break?
We have some preparedness plan, and the various components, I would not say it's optimal. We need this opportunity to look at areas that we need to strengthen and improve on the situation. And all the various, what is very crucial now is the surveillance system, which should, one, the detection of the case, if it should happen, and then the surveillance in the wildlife. So all these surveillance systems have been heightened at the facility level, the clinic, health centers, and the hospital. If somebody report there was suspected case, what isolation facilities do we have available? What are the measures that we have regarding personal protective equipment for the staff? All these measures have to, the things and requirements have to be updated and make sure that where there's a likelihood, especially those of us at Accra and the points of entry, to pre-position these items at these areas so that when the people have to call on them, use them to work, to be available. The sensitization of staff or the staff training, and to make sure that we give optimal support for the people with suspected cases without placing ourselves to undue danger and risk. All these are parts of the work for the various working groups within the various 4 working groups that we've identified. So everybody doing his or her part in these groups. We hope that we can't say we are maximally prepared, but then at least the basic requirements have been put in place, and we use the meeting to update our system to ensure all that is required are provided.
All right. Thank you very much. Dr. Bedi Sarkodie is the Director for Disease Surveillance at the Ghana Health Service.